Good evening, and thank you for viewing this presentation on the Chinese culture. This is created by Brian Abrahamson, Sarah Evans, Erica Coleman, and Tanya Jolicoeur. The Chinese culture holds many diverse and colorful people. Across the ages of the population, there are differences and many similarities. Most of these that impact healthcare are very different from those that are held in Western society. Some of the things seen on this slide, this current slide, will be seen throughout the presentation. Religion plays a very important part of healthcare in the Chinese culture. Just like many countries around the world, there are many religions in China. However, Buddhism, Taoism, and Confucianism blend together and form most of the foundational belief systems of the Chinese population. These three religions influence beliefs and practices across the healthcare continuum from birth to death. The family unit plays a big role in providing care for pregnant women. Of note, the paternal grandmother is normally the most involved, but she should be considered during teaching and demonstrations. Temperatures of hot and cold play a large part in the care of childbearing. Keeping warm is often preferred to cold. Nurses should consider the environment in which Chinese women live during a hospital stay. Again, family is very involved and should receive much attention from nurses. Children are very important to families. The normal family in China is 4 grandparents, 2 parents, and 1 child, though in recent years the 1-child restriction has been lifted. Children learn their initial beliefs and values from their parents and are often raised by all the adults in the family. But the head of the home, generally the father or the grandfather, will make the healthcare decisions. Families that are not considered complete are looked down on and avoided. However, we must remember to provide compassionate care to all levels of society. A strong emphasis is placed on academics and can lead to depression and difficulties with other disorders. It is always a struggle for the young Chinese adolescent to develop independence from families, and that should be taken into consideration when providing care to this young population. Mental health is a large stigmatism in the Chinese culture. Providing resources and getting the knowledge of these resources to those in need is extremely important. Differences in body type can affect the amount of medications that is needed, so nurses should consider dosing and things like that for this population. Traditional Chinese medicine should also be taken into account for middle-aged adults. Because mental health is stigmatized, it is an area of healthcare that many Chinese would turn to traditional methods to care for at home rather than going to a hospital. Care for the elderly is provided by their own families. As I stated earlier, the nuclear family in China is a 4-2-1 setup: grandparents, parents, and children. We must be mindful as nurses that many of the elderly Chinese people we take care of came from China directly and may have difficulty with the English language. Many elderly people also believe in traditional Chinese medicines. Herbs and teas, acupuncture, and things like Tai Chi are practiced, often as a replacement for Western medicine. It is important for us to know the involvement of this population in traditional Chinese medicines to make sure there are no dangerous interactions with Western medicine. Death and dying is a taboo subject in the Chinese culture, because many believe that speaking about death will bring bad luck. The trifold belief system of Buddhism, Taoism, and Confucianism place a high value on life and immortality. With this in mind, we must be careful when it comes to end-of-life decisions and who we speak with. Generally, the oldest male figure will make these decisions. Many will remain a full code until death and deny a do not resuscitate order. The Chinese culture and the population in it will do everything they can to continue and prolong life. Home care, especially in the terminally ill, may be a preferred mode of care for this population, though they may be resistant to hospice because of the lack of because of the lack of consideration for medicines. Thank you very much for watching this presentation of the Chinese culture. We hope it has helped you in providing nursing care to this population. Please keep on providing quality, patient-centered, and culturally relevant care to all of your patients.